Hi, welcome to Medicoria. Please like, comment, subscribe, and turn on the notifications. Today we are going to discuss patient demographics. Patient demographics are the basic pieces of information that you will obtain about your patient. Why are patient demographics important? Patient demographics give a unique identity to each and every one of your patients. They also make the process of billing easy. They also ease your communication with the patient, given that you get an understanding of your patient. Patient demographics also help you to identify risk factors for disease in your patient. What are the components of patient demographics? The name, the date of birth and age, the biological sex and gender of the patient, the ethnicity, the occupation, the address, the level of education of the patient, the marital status, the next of kin, the date of admission, the nearest health facility, others based on the discipline in question, and lastly, the insurance information of the patient where applicable. The name of the patient should be the one reflected in their official legal documents. The age of the patient is important because this will determine the likely condition that the patient is suffering from. It's also going to determine the method of communication that you're going to employ to pass on information to the patient. It also affects the decision-making process and issues to do with consent. The biological sex of the patient is their sex according to the sexual organs which they possess or according to their genome. The gender, on the other side, is the patient's own perspective about their sexual orientation. It is important to know both because in some countries, patients may get offended if you refer to them in a gender different from their sexual orientation. The ethnicity of the patient is important because some medical practices are not acceptable in some cultures. The cultural practices may also predispose a patient to certain conditions. Please let me know in the comment box below how your culture interacts with health. The religion of the patient is important for the same reasons as the ethnicity. For example, consider family planning for a Catholic, a pig-to-man heart transplant for a Muslim, or a blood transfusion for a Seventh-day Adventist. Please let me know in the comment box below, how does your religion interact with health? Occupation. Occupation is important because it's going to affect the affordability of the medical services for the patient. It's also going to give you an idea of what the likely condition the patient is coming in with, because some occupations are risk factors for some conditions. For example, the farmers in this picture are predisposed to schistosomiasis. The miners are predisposed to silicosis. People whose jobs involve lifting heavy objects are likely to present with musculoskeletal issues. A politician whose life is mostly sedentary is likely to present with cardiovascular disease. Let me know in the comment box below, how do different professions interact with health, including the medical profession? The address of the patient is important because some places are associated with certain conditions. It's also important because there might be need to contact the patient. It is also important to collect other contact information, for example, the patient's telephone number, their email address, or their postal address. The level of education of the patient is going to affect how the patient understands and perceives their disease. It is also going to affect the effectiveness of communication between you and the patient, and therefore it's going to affect how you plan and package the information for the patient. The marital status is important because it gives you an idea of the level of social support that the patient has. It also tells you a lot about the sexual habits of the patient. The next of kin is that individual that you're going to involve in the decision-making process should the need arise. It is important to know the nearest health facility in order to gauge how quickly this patient can access emergency services. This will affect your decision on whether to admit the patient or not, and on whether to discharge the patient during the course of treatment or not. Thank you very much for watching till the end. In case you benefited from this video, don't forget to smash the like button. Also subscribe to the channel by clicking the clickable link in the middle of your screen bearing the logo of Medicoria. See you in the next video.